I want to give you a couple of examples of why you don't want a government-run health care program. And I guess that would be almost an oxymoron. The government can't run anything very well, and certainly I don't want to run our health care. If you look at the Canadian model where health care is a budgeted issue, just like fuel in our budget, once you've used all those health care dollars, you create waits. Example, if you come in and have a heart attack, we do a heart cath, you say, Dr. Rowe, you need a bypass operation. You go on a list, and when your name comes up, you get your bypass if you're still alive. The average hip replacement takes 3 years in Canada. Here you can get it as soon as you can set up with your doctor and make arrangements, and you make the decision. Health care, and I want to explain how it's paid for. You pay for it no matter what, whether it's government run or whether it's private insurance. In the private sector, you pay for it by lower wages, or it costs us more to buy products that we go out and buy, or services that we buy. In the government run, you pay for it by higher taxes or deficit spending. And I'll tell you who I want in control after practicing medicine for 37 years. I want you, the patient, in control, because no one knows better about what's good for your health care and your family but you. You do not want the government doing that. And I was telling you earlier about cancer research. MD Anderson Hospital in Houston, Texas, a famous hospital, spends more money, one hospital in America spends more money on cancer research than the entire country of Canada does. So I would say no to a health plan, to a government-run plan. There are a lot of ideas, and this is not simple, I can tell you. One of the other, briefly I'll talk to you about how they've taken the competition out of health care. Our practice does a certain test, and we do thousands of them every year. And we negotiated a price which was cheaper than what Medicare paid. You couldn't do that. The federal law doesn't allow you to charge less than Medicare. So all of my patients paid more money because of a bureaucratic rule. It's foolish and it's silly. I'm going to introduce you to a patient of mine, one of the last ones I operated on, Linda. She came in to see me and had a severe precancer problem. And I suggested that she have surgery. It took me more time on the telephone to get her surgery approved than me actually doing the surgical procedure, a major surgical procedure. There's something bad wrong with that, ladies and gentlemen, when the bureaucracy is so bad, it takes you longer to get the case approved than actually doing the case. In Medicare today, there's a proposed 10% cuts this summer. And I was already, by the time I was finishing my practice, asking personal friends of mine to take patients as primary care. We're not going to have continued primary care physicians being able to even see our patients because of the reimbursements that they're having. The other thing that's a little bit disturbing, we've got wonderful people from all over the country who come to practice here, but it's a little disturbing that 75% of all residents in training in primary care, that's family practice, internal medicine, and pediatrics, English is not their first language. And we've got to do something about that and encourage our young people to do this.